So welcome to the second part. So now we'll be discussing about the obesity management. So as a physiotherapist, whenever we are planning management for a obese patient, we have to consider two things. One, patient sometimes they directly don't come to us with the problem of weight loss. So they will come to us with something else like back pain or knee pain, where we'll discover that okay, the obesity is one of the factor which is responsible for their problem, or the obesity needs to be addressed in these patients. So we have to divide our management accordingly. So like one thing is we have to prescribe the weight management to the patient. Another thing is if the patient is suppose not willing for the weight loss or they are not very much interested for those programs, at least we have to address the issue of obesity in their treatment program. So the universal plan for obesity management, the number one thing is you need to have a preventive services. You need to prevent obesity to develop. Next, when the obesity is already there, so we have to, the first choice of the management is lifestyle management. So lifestyle management, which we are going to discuss in detail. Then the next will be if the clinical obesity is present, which is complicated by some clinical metabolic disorders. So we have to go for the specialist multidisciplinary weight management program, where the pharmacotherapy will be considered and some other therapies will be also considered. And if the complications are more and patient is not responding to the lifestyle management, then we can consider for the bariatric surgery. So whenever you are managing the patient with obesity, so you have to consider these 5 A's. That is ask, assess, advise, agree, and assist. So you have to always ask for the permission from the patient to discuss the weight problem, as it can be sometimes it can be a sensitive issue. So you need to first explore the readiness to the change and address those weight issues. Then you have to assess the patient for the stage of obesity, the BMI, the other comorbidities, the complications, and their barrier for the lifestyle management. Then you have to advise the patient, where you have to discuss the benefit of the weight loss in context of their quality of life, and you have to discuss the treatment options. Then you have to agree to the realistic weight loss expectations, where you have to agree on smart behavioral change goals and the treatment plan. Then you have to assist the patient in addressing the barriers, in addressing the drivers, and you have to assist the patient for utilizing the resources, whatever is available, and arrange a follow-up program. So first we'll be discussing about the lifestyle modification, where you have to provide a combination of the program where the calorie restriction, which is not exactly like you have to restrict your calories to such a level that that set point theory again it will occur. So you have to give them a good nutritional calorie restriction and increase their physical activity, and most importantly bring the behavioral changes in day-to-day life. So the lifestyle modification, it will consist of balanced diet. You have to stop the addiction like smoking and alcohol. You have to manage your stress well. You have to include the physical activity as a daily part of your routine. And very importantly, you have to manage a adequate and regular sleep routine. So whenever, as a physiotherapist, our main role in addressing the weight issue is by through exercises. So when we are giving exercise prescription for the patient to become fit, we need to follow the FIT principle. That is your frequency, intensity, time, and type. So when we are talking about the frequency, as per ACSM guidelines, minimum 3 days in a week and at least 30 minutes time you have to give for your physical activity. That is your planned exercise. So the good program, it will consider of 4 to 5 days at least of aerobic and resistance training and 1 to 2 days of rest. So now we'll talk about the intensity. So whenever we are giving exercise to the obese patient, many of the patients, they will go for some high intensity exercises like HIIT training or some other program. But the problem with the high intensity program is when we are doing high intensity program, it is not very ideal for losing weight compared to the low to moderate intensity exercise program. The reason is when we are doing exercise from 55 to 70% of VO2 max, we are in the fat burning zone. The reason is behind, if we'll go back to our biochemistry classes, so reason behind it, when we are doing the exercise, what kind of fuel we are using. So initially we are using the blood glucose level and then liver glycogen stores. So high intensity exercises are mainly for short duration and where we are mainly burning our carbohydrate and glucose as a source of energy. So when you are doing the exercise for the longer duration, that is more than 20 minutes, where the fatty acid and the fat come as a source of energy, you are going to utilize the fat more. Other reason is for the fat oxidation, you require oxygen. So when you are doing the moderate intensity or low intensity exercise program for longer duration, the uh, exercise, the oxygen is readily available for the exercising muscles. So the fat will be oxidized better. Third reason will be the lactate generation, which will stop your fat metabolism. That will come late in the low to moderate intensity exercise. And the other reason is when you are directly starting to the unaccustomed patient, the high intensity exercise, the chances of injuries in the joints can be high. So first, in the starting initial phase, you have to go for the low to moderate intensity exercise, and later on to maintain the benefit and to get the more cardiorespiratory training effects, you can go for the high intensity exercises. Next, what type of exercises we have to do? So we have to do aerobic exercises and strength training exercises for the weight loss. Why strength training is very important for an obese patient? Because when you are doing regular strength training exercise at least 2 to 3 times in a week with 2 to 4 sets of 8 to 10 repetitions, you are going to increase your resting metabolic rate. So your muscles will automatically burn more calories even at the rest. You will preserve your muscle mass during the weight loss program. Otherwise, with the weight loss, you will also lose your lean body mass. It will again boost your post exercise oxygen consumption. So you will burn the calories for up to 24 to 48 hours also post exercise. Resistance exercise are proven to improve your insulin sensitivity. So it will enhance your glucose uptake. It will change your body composition. It will reduce your visceral fat, and definitely the aerobic and strength training exercise program, it is having a psychological and functional benefit. Now moving to the next part, whenever the patient with obesity is coming to our clinic, we can obviously see that they are having a lot of postural problems also. Many times their posture is altered because of obesity. So whenever you are treating such patients, even for the weight loss program or some other exercise, you always need to remember that reduce the joint stress, especially on spine, hip and knee. You have to prevent the musculoskeletal pain. You have to improve the breathing pattern. You have to enhance movement efficiency and balance, promote better body awareness and confidence in these patients. So exercise, starting the exercise is easy, but adhering to is sometimes become difficult. So that is where the behavioral changes and the education of the patient, it becomes very important, so the patient can continue these programs for the longer duration. So now to overcome the barrier of this exercise adherence, you have to prescribe either home based versus on site exercises. So you need to choose the protocol very carefully, where if you know that on site exercises or going to gym, it is difficult for the patient, so you can choose simple home based exercises and ask them to stay more physically active throughout the day, so which can be done at the comfort of home, and patient will be definitely more adhere to them. Then lifestyle activity, like they can increase their overall physical activity throughout the day and decreasing their sedentary behavior. So to overcome this barrier to exercise, we just have to follow some simple tips. So that simple tips is simplify the exercise, impart knowledge, modify beliefs, promote alliance, leave biases, evaluate the patient properly, technology, because nowadays technology plays a very important role. So even we can utilize this technology for our weight loss programs also. You have to identify the barrier particular to that person. You have to plan the follow-up and set the smart goals. So now comes to the behavioral modification, which is a very important part of the weight loss program. So first thing is self monitoring. So self monitoring can be done either through writing diaries or either using specific apps are there nowadays, which will give you an idea how much calorie intake you are taking and how much calorie expenditure you are doing, what additional calories you have taken today, so you can at least balance it in the week. Then stimulus control. So different techniques for the stimulus control can be used. You need to educate the patient for that. The positive body image and self-esteem counseling. The stress management, as it is a very important, it plays a very important role in obesity management. For Indian mothers, stop eating leftover food from the kids. So sometimes we do need to overeat whatever, so it should not go for the waste, but we need to stop that habit. Social eating is very common in India. So, and eating outside nowadays, it is that is also increased. So social eating, whenever these wedding seasons and other events are coming, try to have food at home, then go to the social events when you are on a weight loss program, and try to consider the more healthier option when you are considering eating outside of home. Then stop emotional eating. So many a times to celebrate or when we are depressed, we find the solution through eating. So that needs to be addressed carefully, where emotional eating should not come in the way of our weight management program. Then you have to address the family views on the weight. So you have to promote more healthy atmosphere in the family itself, so the whole family can stay healthy. The nutritional consultation and meal planning is very important. Remove less healthy foods from the home. So whenever you are buying the packed foods, try to read the labels behind it. Try to see how much sugar, how much sodium, how much other calories are there in this food, and try to limit your mindless snacking. And lastly, and most importantly, in behavioral modification, you need to improve your sleep quality. So try to reduce the uses of your mobile phone in the night. Try to practice good sleep hygiene so you can improve the sleep quality. As sleep is one thing which will definitely helps to improve your weight loss goals. So beyond weight loss, as I have told in starting, many times the patient doesn't come to us directly with the goal of weight loss. So when the patient is coming to the clinic and you know that the patient is obese, slowly you can discuss the weight loss options. But at the same time, you need to maintain these things while treating the patient. Like you have to reduce the excess mechanical load on the joints, like you use low impact exercise like aquatic therapy, cycling, and resistant bands. You have to address the altered biomechanics and postures. So you need to include the postural correction exercises, core strengthening, and gait training for these patients. Reduced flexibility and range of motion can be present. So gentle mobility drills, dynamic stretching, and functional range of motion exercises can be considered. Muscle imbalance and deconditioning can be present in this patient. So progressive resistance training focused on the functional strength, it should be a goal. An obese patient can have cardiorespiratory strains. So, interval training, graded aerobic exercise, and pulmonary hygiene, if needed, it should be given to the patient. Then, foot and ankle can be loaded when we are giving some exercises. So, proper footwear advices, orthotic support, and ankle strengthening should be considered. Psychological considerations are very important, especially when you're talking about weight. You need to do motivational interviewing, group classes, safe, non intimidating environment should be provided. And sometimes when we are giving exercise to this patient, especially when the hot environment is there, heat tolerance, intolerance, and sweating can be common in those patients. So try to exercise in cooler environment, shorter bouts, and hydration level should be maintained. And suppose you have to put the patient in some specific position, like for example prone position, it can be very difficult for the obese patient. So support positioning and comfort level of the patient by using different pillows, wedges, seated position for the comfort and accessibility. And electrotherapy, when we are providing to these patients, you need to just remember that obese patients can have increased skin and tissue resistance, so which can also known as impedance, so which can affect our delivery and effectiveness of electrotherapy. So the proper precautions to decrease the skin resistance and size of electrode should be considered. So in the last, when we are empowering this obese patient through our physiotherapy, we just need to know that through knowledge, support, movement, and self belief, we can empower these patients. So, your body can stand almost anything, it's your mind that you have to convince. So, once again, thank you for your attention.
Thank you so much, ma'am, for such an insightful talk for today. I'm very sure our audience has so much more to learn today. So, with this, I would like to thank our chairperson, Mrs. Manisha Sangvi, ma'am, our principal, sir, Dr. Apurva Shimpi, and our technical team of Physio TV for today's enlightening session. Thank you once more. Stay tuned for more such content.